One thing that a lot of patients struggle with is back pain or lower extremity pain with sitting. And one factor of seats is the slope or the angle from the hips to the back of the knees. Now, most chairs in office settings are not that bucket-like, but car seats can be very bucket-like. So one thing I ask patients to do is kind of just do the arm test. And if your elbow is higher than your hand, then there's a slope. Now, sometimes you have to push down because the back will sink deeper than the front. But if it's level to the ground or parallel to the ground, there's no slope. But many car seats, if you put your arm down, your forearm down, it will not be level. It'll be higher in the front. There are a couple of simple ways to remedy this. Anything from folding a towel and putting it under the hips, putting a pillow just under the hips, or a book. You can also buy a car seat wedge, which I definitely think is worth the investment for most people, as they will last for a long time. This one I got at Relax the Back many years ago. It's about $100, I think, and it's 3 inches in the back, 1 inch in the front, and it's quite firm, and it doesn't have that cutout for the tailbone, which I don't like because that space tends to collapse and kind of detract from the firmness that we want. So you don't have to buy anything special. Again, a folded towel or something under your hips will work. And what is it doing? Well, it's taking away the angle of flexion primarily in the back. It's also reducing the angle of flexion in the hip, but most importantly, and for what matters for most people, it's that angle of the lumbar spine of the low back. So do I recommend that everyone have a level seat at all times? I do, but especially if people are having symptoms, it's something to look for to see if that slope in the seat, that bucket-likeness of the seat, is contributing to your pain. It's not going to fix a disorder, but for people who are going through therapy, it can be part of a larger therapeutic approach if we need to reduce that angle of flexion in the low back and or hip to take some pressure off of it and allow it to heal. And then this other part of the therapy is doing the intervention that actually targets the mechanical force in the low back, but reducing this force can be a very important part of that process.